Did you know that around half of all individuals with systemic lupus erythematosus, SLE or lupus, may go on to develop a serious disease called lupus nephritis? Lupus is an autoimmune disease in which the immune system attacks various parts of the body. In lupus nephritis, your immune system attacks your kidneys. Today, we'll take a closer look at lupus nephritis, the importance of early detection through routine testing and treatment to help improve long-term outcomes for people living with lupus nephritis. I'm Ereka Vetrini. Access Health starts now. Lupus nephritis is a serious complication of lupus. With lupus nephritis, your kidneys cannot function properly to remove waste from your blood and control the amount of fluids in your body. Kidney disease caused by lupus can create many health problems, cause permanent damage, and can even lead to kidney failure. Monique is a lupus nephritis warrior, an advocate known as the lemonade maker for her unbreakable spirit and her voice of encouragement to others with lupus nephritis. Take a look.
I remember it so vividly. I had left a bridal workshop a few weeks after my husband and I were engaged, and I knew that I was already starting to feel certain symptoms. My hair was twisted, I opened it, and I had a patch in the middle of my head. My hair completely fell out. And a few days later, I went for a fitting and I was swollen. I was having a lot of different pain and I was already starting to not look like myself. So at this time, I was diagnosed with lupus, and that was right before our wedding. I would go get tests done and take the medication, and I felt like I was not really having a lot of great results. I remember being so hurt, and I remember thinking, like, how can I live like this? The person that I was engaged to, we did indeed get married. It was a really hard day, but we made it. Shortly thereafter, they had asked me to be a part of the national campaign called the No Lupus campaign. I'd become an advocate at this time and gone down to DC for a lot of different advocacy events. And all the while, I was still being ravaged by lupus. It's just one of those things where you are up and running one day and another day, the wind is being knocked out of you. I have been getting better over the years, and this cape is a really good symbol of getting stronger, getting better. I am someone who is still fighting for my life. The journey that I'm on right now has been worthwhile, not just for myself, but for other patients. We're working towards an agenda that will raise the bar for better wellness. I believe that patients during this process will have a better seat at the table and that they themselves will feel like they are more empowered. I'm really glad to be a part of that.
What an amazing woman. Monique will be joining me later in the show, so I'm super excited about that. But first, here to help us get a better understanding of lupus nephritis is rheumatologist Dr. Alvin Wells, director of the Aurora Rheumatology and Immunotherapy Center in Franklin, Wisconsin.
A rheumatologist treats diseases of the skin, muscle, bones, and joints. And one of the ways to think about it, we call it the connective tissue, the stuff that holds the body together, whether it's the eyes, the skin, the heart, or the kidneys. Because with patients with lupus, the body's immune system turns against itself, and we use all of our training to help to get the disease under control. So when I think about patients who are impacted with lupus nephritis, I first think about who has lupus. Lupus usually occurs in female patients, young ladies, it can be 18, 20, 22 years old. And here's a fact, we know that patients of color, they're impacted even more so than other patient populations. That's a young African American, Hispanic, Asian, or Native American patient. Remember, lupus is a chronic disease, so patients will be dealing with this for a long period of time. And over the course of that disease, about 40 to 50% of the patients at some time period may have lupus nephritis. In patients with lupus nephritis, the body's immune system goes after those certain components of the kidneys, leading to some of the signs and symptoms that we see in patients with lupus nephritis. It brings to mind, when I was in school, we had the little milk cartons and we'd all take the little straw and we'd blow some bubbles in that. I still use that analogy because indeed that's what the urine looks like in patients with lupus nephritis. They get this frothy, kind of bubbly type of urine. When we think about the kidneys help us to get rid of fluid, and some patients who are impacted with lupus nephritis, the kidneys don't function as well. And therefore we see the fluid backs up. So we can see swelling of the ankles. That can translate to some shortness of breath and other features that we see. When it comes to lupus nephritis, there are some clinical features that patients should watch out for. First of all, there are some patients who have no features at all, and that's the importance of following up on a regular basis with your healthcare provider so we can do the things that we routinely do. In many practices, including my own, we see patients every 3 or 4 months so I can monitor their blood counts. I can monitor their urine. I can monitor their vital signs, including their blood pressure.
Coming up, how early diagnosis and treatment of lupus nephritis can help reduce the risk of serious health problems and prevent permanent kidney damage. Welcome back. As with lupus, living with lupus nephritis requires visits with appropriate doctors to manage different parts of the disease. A diagnosis of lupus nephritis is usually made by a nephrologist or rheumatologist and generally requires a kidney biopsy. Let's go back to Dr. Wells for more.
I really stress with my patients with lupus that their routine follow-ups are paramount. That indeed, I'm not only looking at the clinical features, I'm not only looking at the blood tests, I'm most important in looking at the urinalysis. So with the urinalysis, it gives me a scope of what's going on inside the kidneys themselves. And indeed, in a normal kidney where I shouldn't see certain things like red blood cells and protein, once there's a hint of those features in the urine of a lady with lupus, that can be the heralding feature that it can be some signs of lupus nephritis. So I tell people, whether you come physically to the office or whether we're doing these things by using all of these new technologies that we have with telemedicine, that allows me to monitor my patients on a routine basis and allows other healthcare providers to making sure we capture and diagnose lupus nephritis sooner rather than later.
To confirm a diagnosis of lupus nephritis, your nephrologist or your kidney doctor or another medical specialist, such as a radiologist, may perform a kidney biopsy. Joining us now is Dr. Dawn Castor, a specialist in the Division of Nephrology at the University of Louisville School of Medicine.
A kidney biopsy is the gold standard for diagnosing lupus nephritis. Some of the signs and symptoms of lupus nephritis suggest inflammation in the kidney, but the only way to confirm that is to take a piece of that kidney tissue and look at it under the microscope. There are signs and symptoms that we do associate with lupus nephritis. Identifying the inflammation in the kidney is critical to the diagnosis. Additionally, identifying how much inflammation and how much scarring is in the kidney tissue helps clinicians guide therapy. Lupus nephritis can be associated with several complications, including high blood pressure, fluid retention, and edema. Additionally, increased cardiovascular risk. It can lead to chronic kidney disease, progressive kidney function decline, and eventually kidney failure. So if you are a patient with lupus, it is so critical that you have your urine checked as well as your kidney function checked, because it can be silent and you might not have any signs or symptoms. The goal of treatment of lupus nephritis is to get the inflammation in the kidneys under better control and decrease further kidney damage. The treatment of lupus nephritis consists of immunosuppressive medications. Depending on the severity of lupus nephritis, immunosuppressants are given to help control the immune system and reduce the immune attack on the kidney. Because patients with lupus nephritis often have high blood pressure, patients are treated with blood pressure lowering medications, which also can help preserve kidney function and reduce protein in the urine. Finally, antimalarials are a cornerstone of treatment for systemic lupus, and in patients with lupus nephritis have been found to have additional benefits in controlling lupus nephritis. While treatment is vital for lupus nephritis, certain lifestyle choices such as diet and exercise can also help play a critical role in managing your disease. Lupus nephritis can be a devastating disease, but there is a lot of hope. We're finding new treatments all the time. We're understanding the disease better. I would love to not see young women go into kidney failure from this disease. I think it's so important that there be early diagnosis and treatment to prevent this from happening.
Coming up, a conversation with Monique and cooking delicious kidney-friendly food. Welcome back. My next guest is not only a person living with lupus nephritis and lupus, she's the proud recipient of the Lupus Foundation of America's 2018 Advocate of the Year Award, as well as a motivational speaker, a community ambassador, and a committed volunteer. She is also affectionately known as the lemonade maker within the lupus nephritis and lupus community. Hello, Monique. It's so nice to meet you. You know what? You're an inspiration already to me, and of course to those in the lupus and the lupus nephritis community. I have to know, where did the name lemonade maker come from?
That's a great question that I often get. A lot of people do ask me, am I in the business of making lemonade? Lemonade makers, what do you do when you're dealt with the lemons of life?
I can see that. That totally makes sense. And it seems that you have definitely done that. So we heard a bit of your story earlier about how you were diagnosed 3 months before your wedding day with lupus, and then right after your honeymoon with lupus nephritis. How and when were you diagnosed with lupus nephritis?
After getting married, my husband and I continued on to our honeymoon. We went to Bahia, Brazil. You know, we had really long days and it was extremely hot. And I knew that I was not feeling my best, but I pushed through for the 2 weeks. When I got back, the doctor issued a 24-hour urine test, and I then was admitted to the hospital where further imaging, biopsy were done to really kind of conclusively diagnose me with lupus nephritis.
Did you have any indication when you were initially told you had lupus that lupus nephritis was a potential complication?
I had symptoms. I knew that even after the lupus diagnosis, and I really still felt like things were progressing. I was having UTIs, blood in my urine, proteinuria. I was having lower back pain, a lot of cramping, swelling in my feet and in my ankles. Every time I had an appointment, I did not know how to paint that picture for them because I didn't even know that lupus nephritis was an option.
So what were you thinking and feeling when you received your lupus nephritis diagnosis?
I felt validated having a more extensive and conclusive diagnosis, but I also felt blindsided because I felt like I had a lupus diagnosis already. I felt like that was more than enough. And this was just something so much more invasive.
So how was it managing that as a newly engaged, then newly married couple?
We were still trying to learn each other. I was still trying to learn what in the world it meant to live with lupus, and on top of that, lupus nephritis. Financially, we had no idea of what the impact of this disease would be. Oftentimes, we were denied with insurance. There were medications that were prescribed that were not even covered by insurance. I had to stop working and eventually go on disability, which is not something that I wanted to do. So it was really a daunting time, not just for myself and for my husband, but for everyone that was connected to us.
So what do you think is important to hear for people living with lupus about the risks of lupus nephritis?
It's important that every patient knows that surveillance of what's happening with their kidneys, with lupus. That is something really, really critical to stay on top of.
So what words of encouragement do you have for someone who is newly diagnosed with lupus nephritis?
Well, I would tell them they're not alone in this fight. There are so many companies, organizations that are fighting for you and fighting for me every single day, and that they're truly, truly part of what keeps us going. When I say us, the community of patients. So they're just an additional link that's in the chain, and that they should feel connected to a bigger purpose. And living with lupus nephritis, treating lupus nephritis, but also how we move the ball along in better care with this disease.
Monique, it's such a pleasure meeting you. It's so eye-opening. I have learned so much from you. Thank you for joining us today.
Thank you, Ereka, from the bottom of my heart. Thank you so much for seeing me, hearing me, and allowing me to share this time with you.
Coming up, a program designed to increase awareness and empower those with lupus nephritis. And I'll be in the kitchen cooking up a kidney-friendly superfood. We're back, and as you can see, I'm in my favorite natural habitat, the kitchen. Now, if you follow me on Instagram, you know how much I love to cook. Today, we've been discussing lupus nephritis and its effects on the kidneys. And according to the National Kidney Foundation, it's important to maintain a kidney-friendly diet. There's lots of things to think about as far as managing your sodium, your potassium, proteins, and phosphorus. One of my favorite things to do with cauliflower is to roast it, whether I cut it into steaks or whether, as you can see here, I roast it whole. It makes for such a beautiful presentation, and it's really fun to cut into.
Doesn't that head look gorgeous? Let's roast some cauliflower.
I'm going to take these lovely little cauliflower pieces, and I'm actually going to boil them in some water for just a few minutes. The important tip here is to really dry out your cauliflower. You don't want a lot of excess moisture in the baking dish. Okay, let's season it up. We want to make sure it's low in sodium and low in fat, so I'm going to season this with some onion powder, garlic. We're going to skip the salt, but we are going to add some dried thyme. You can actually also add rosemary, parsley, any herbs will do to really bump up the flavor. Then I'm going to take a little drizzle of olive oil. We want to make sure we get that caramelization. And the last thing we're going to do is we're going to sprinkle some low sodium, low fat grated Parmesan cheese and some panko breadcrumbs, just a bit to give it a little bit of a crunch. So this is going to go into the oven for 20 minutes. Wait till you see how it comes out. And 20 minutes later, you've got this gorgeous, crispy cauliflower au gratin. How good does that look? I gotta take a bite. Yeah, it's amazing. Crunchy, full of flavor, so good. We've got a very special segment next. We are talking to Bianca J., Senior Director Marketing with Aurinia Pharmaceuticals. Hello, Bianca.
Hi, Erica.
Thank you so much for joining us today. So tell us a little more about the AllIn program and the passion behind it.
Sure. So the AllIn program is really a set of resources for those living with lupus and lupus nephritis. Our main goal was to try to raise awareness about the risk for lupus nephritis with those living with lupus. The passion behind it is really those in the community. Like Monique, we've had the opportunity to talk to several people living with lupus and lupus nephritis. We use their feedback, their insights, and their experiences to put together resources, tools, and content that we really hope will help the community. It's all about being able to support this community who are fighters, who try so hard to make it through each day, and they have challenges, but they also have triumphs, and it's important for us to share that with everyone.
How nice to have a community to turn to.
Yes, one of the first meetings we had, someone told us they really hadn't had the opportunity to meet anyone else diagnosed with lupus nephritis in their community. And for that reason, it was really important for us that we showed real people within our program. When you go to our website on the homepage, those are all real people living with lupus and lupus nephritis. We also had the opportunity to share their stories. We've been so fortunate that they wanted to share their stories with the community, and they're really honest. We have a variety of people from different stages of their lupus nephritis, from when they were diagnosed, and we really hope that we're helping to form a community among those living with the condition.
So Bianca, once you've signed up for the AllIn program, what's next?
They immediately will have access to our lupus nephritis awareness kit. They'll get an email with those resources sent to them, and shortly after, they'll get a box that includes disease awareness bracelets, a USB drive with those PDFs of those tools, and a hard copy brochure all about lupus nephritis. Our kit itself also includes resources about how to talk to family and friends, a sample letter, so if you're starting a new job or a new school, ways that you can talk to lupus nephritis with your employer or your teachers.
And it's so important to have trusted resources.
We hope so. That was one of the reasons that before we even put the awareness kit out there for people to be able to order, that we went back to our community of people living with the condition and asked them, is this what you told us? Is this what you're looking for? Is this what you think would be helpful to people who are newly diagnosed with lupus nephritis, or for those living with lupus who want to learn more? And we took their feedback directly into those pieces before we finished developing them.
Now, for those who are listening and would like some more information, where can they go?
They can go to allinforln.com.
Bianca, thank you so much for your time today. I know how important this information is to the lupus and the lupus nephritis community.
Thank you, Erica.
Again, thank you for all your time. I would like to sincerely thank all of our guests today, Monique for sharing her insight, and of course the AllIn program for what you do to support the lupus nephritis community. If you've missed anything we've discussed today, you can also visit our website. See you next time.